take just a moment to introduce Liz to everyone. If you weren't with us last month, she is a licensed massage therapist back to 1996. She specializes in movement-focused bodywork, injury rehab, sports and Eastern modalities, expansive experience as a massage therapist, as well as an instructor for massage programs. Previously served as owner of the Pura Vida College of Massage Therapy. She's an Ayurveda wellness coach and mindfulness instructor who's currently training for her MBSR certification at Brown University. And you can find Liz at the Park City Live Well Center, where she teaches yoga and mindfulness classes and really just helps people feel better in their bodies. So we are super thrilled to have her as part of our Live Well team and to be here with us today. And before I turn it over to Liz, from one Liz to another, I wanted to tell the group that we thought we would do something special with our Live Well webinar today. And that is we are going to have a random drawing for a 30-minute massage up at the Park City Live Well Center. So for all of you who are joining us today, your names will be entered into a random drawing for a 30-minute free massage at the Park City Live Well Center. So today was a good day to join the Live Well webinar. So, all right, with that as the introduction, Liz, I'm going to put myself on mute and turn it over to you. Oh, and for everyone else, please make sure your phone or your computer is muted. You can put your questions in the chat. And as we get towards the end of our 30 minutes together, I will facilitate a Q&A with Liz.
Excellent. So I thought I would just add to that gift certificate if they wanted to upgrade to a 60-minute, I'm sure that would be, okay. Just to know that you would get the 30-minute, free, and then it just if you want to upgrade. So a lot of people would prefer 60 over 30. So anyway, so happy to be here tonight. As you heard, I've been doing massage for a really long time, and I started teaching this class as a little workshop, calling it Massage 101, because I saw this repeated situation where somebody would come in to get a massage and they'd say, gosh, I just asked my husband if he would just rub my neck a little bit, and now I can't turn my head. And I don't know, maybe you've had an experience like that or know somebody. And I thought, most people don't want it. Not everybody wants to be a massage therapist, but it sure would be nice just to have some skills that you could use to help a friend or a family member that was really hurting and to know what you were doing. And so that's what started this workshop. And then today we're just going to condense it into a few little techniques that we can do. So first of all, I just want to mention that when you do offer to work on somebody, set up the space. And it doesn't have to be, quite this elaborate. This was just a really nice, relaxing picture. But the idea is to give your full attention and to not be on your electronics. Turn your phone off. Make sure the TV's not on. If you are working on someone at home, make sure that you're able to give them attention. If there's children around, just ask them, for 15 minutes of time alone or something like that. But what you really want to just do is make sure that you're giving this person your full attention and the space is set up for relaxation. And massage is for everybody. I just thought this cute little baby was a fun picture to start with because infant massage is a real thing, and it's really helpful for new parents if they just know a few little things that they can do for their baby that can help with colic and immune functions and digestive issues and just their bodies. All their organs are getting used to being in this world and working on their own. Massage can be really helpful. But infants to elderly, sports massage to rehab, manual lymph drainage is a technique that's really helpful for people that have lymph issues. If you've lost lymph nodes, like I've worked on several women who have had breast removed from breast cancer, and so they lost some lymph nodes. And so lymph drainage massage has been really helpful so that their hands don't swell up because they don't have the lymph nodes to do their function. Oncology massage, so for cancer patients. Sports massage is, right now we have a team that's called the Podium Project. And so we get these triathletes that are coming in for their regular massage. It helps with them in recovery. It helps with their performance. And if anyone is injured, massage can be really helpful with the tissue in recovering. It helps with the circulation of blood and lymph and pain management. So there's a lot of different reasons to get a massage. There's a few reasons why you wouldn't. We do have some contraindications. And if you're going to work on somebody at home, it's just good to know some basic, some rules. And a general one is if someone has a fever, the massage is contraindicated because the body needs to work to fight the fever. But sometimes people might feel like a little bit of touch or their neck might be really hurting them. Just know that a fever is a contraindication. And I don't want to spend a lot of time on this because it's not something that you'll probably come in contact with, but generally just be mindful of the person you're working on and what it is that you are going to do for them. And reflexology is a really safe place to start. These are pressure points that are on the hands and the feet. So basically, you've got all these different pressure points that access different organs and glands in the body through different nerve endings. So a fun thing to do, if you have a partner, you can sit across from each other on the couch and just start working on each other's feet. And if you want to initiate it, you can just say, follow me. But basically, on the feet, you're just working in zones. So you're working from the heel up to the big toe, the second toe, up to the third toe, up to the fourth toe, and to the little toe. And so that's just a really general, easy access, very safe way to do some reflexology on somebody. You can also take fingers and toes right at the base. This is the neck and the sinuses. So just a nice little twist, and you might even just want to try this on yourself. This helps to loosen up the neck. And if you do have some sinus issues, it can help to clear the sinuses. So, so that's just a little bit of reflexology, and there's plenty of information that you can find if you want to get like one of these charts so you can see specifically. But like I said, just a really safe way is just working from the heel up to each toe. You just think of the 5 zones. So in the hands, it would be the same thing. You're just each zone, and you just work with a little thumb pressure. You can use your knuckles, and that's really relieving. Most people generally really enjoy having their feet worked on because they're so tired and because of all these different pressure points. This is another, this was a really hard picture to find. And again, this isn't something I'm going to spend a lot of time on, but I just want you to be aware of what the ability of massage and what we do. In the body, you have these different meridians that are like a superhighway. And this is the flow of qi, and blood flows with the qi. And qi is the Chinese word for your life force energy. And we can call it our blood, we can call it prana. There's different words that you might have heard already. But essentially, where one meridian is ending, another one is beginning. And they're from head to toe, and they're on the sides. That covers your whole body. So just also know that when you're working on the body, that you have all these different meridians. And in Chinese medicine, the theory is when you have pain in the body, it's caused by stagnant energy. And so working these different meridians, you're restoring the flow of energy. And I'm going to show you 2 really specific pressure points that are really helpful a little bit soon, later, as in right now. So these are some of the techniques that I thought we could go through that would be really fun to do together. And the first one, just for your parasympathetic nervous system, just some basic breath work. So if you're sitting at your desk, or maybe you just got home, or you just are feeling a little stressed, you can start with some breath work, and that is probably the easiest and the fastest way to just help yourself just decompress a little bit, regain focus, and just have some clarity. So the one I like to teach is called the 4-count breath, and that's really simple. You inhale through the nose for 4 counts, hold your breath for 4 counts at the top of the inhale, and exhale through the mouth for 4 counts. So let me guide you through a few, and then I'm going to just kind of wane off and let you take it on your own. So if you'd like, you can either gaze down softly or close your eyes. Make sure you're sitting comfortably. If you're in a chair, try to have your feet flat on the floor. But you don't want any distractions to distract you from the focus of our practice here. So we're going to start with inhaling through the nose for 4 counts. Hold. Exhale. Inhale through the nose. Hold. Exhale through the mouth. Inhale through the nose. Hold. And exhale. Inhale. Hold. And exhale. And now I'm just going to let you take this at your own for 30 more seconds. Then resume your normal breathing. So maybe you've just noticed a difference just through that short practice. So you can see how just using your breath to help you focus and relax, that can be such a great little go-to. So just keep that little nugget in your tool bag. The next one is the picture. You can see this lady with her legs up the wall, and this is called the waterfall pose. And this is just a really excellent one to come home at the end of the day and just take a little time out. I like to suggest setting a timer for 10 minutes so you're not thinking about what time it is or how long you've been here or how long you should be there. And just scooch up to the wall, legs go up the wall so you're getting a nice blood drain, the feet are able to relax. And if you'd like a neck support, there's other little props that you might want to have here just to make this a little bit more comfortable. But the idea is just having your arms out to the side, the feet are up the wall, and then just closing your eyes. And I would suggest dimming the lights and just setting the presence for relaxation. I might get stuck if I'm in that position. And you know what? You don't have to be really close to the wall. It can, if you want more of a slant, more of like a bridge kind of a slant, that's fine too. The idea is just to get that incline. So just whatever's comfortable. I've even used this in the middle of the day if I was having kind of a stressful day, just shutting the office door and putting my legs up the wall, setting the timer, just doing some breath work. You can do your 4-count breath here. Those are real complements to each other. That helps to keep your mind busy. And one reason I suggest doing counting with the breath is so that our to-do list and other things that might have a tendency to want to come in to occupy our mind, the space is not available because our mind is busy counting for us. So if this is new to you, it's really a great compass to just start with to keep yourself on track when you're learning to these new practices. So that's the waterfall pose. And once you come down from here, the next one is just a really great back stretch. You're just going to bend the knees and bring them into your chest. And you just hold them as tight as you can. And then just take some hip circles and just take your bent knees and just go clockwise and counterclockwise. and then back into the tuck. And just kind of work those hip flexors a little bit when you've got those hip circles going clockwise and then back counterclockwise. If you sit a fair amount, our hip flexors get really compressed. And so this is a great way to give some attention to that area of the body and allow it some space and just an opportunity to decompress a little bit. So the next one that we're going to talk about is doing self-traction. And this one's going to be a little bit harder to show, but I'm going to do my best. So basically at the base of your spine, there's a little ridge, and it's called the occipital ridge. And when I work on people, I do a little traction. And how it works, so if you're going to work on somebody else, you're going to have their head right, the occipital ridge is going to be right here on your fingertips. And so you're just going to kind of like lock into that. And then you're going to ask them to take a breath in. And on their exhale, you're just going to just give a gentle stretching, a gentle persuasion, and just hold. It's not a movement up, it's not a movement down, it's just straight back. And if you can hold this position so you're doing this on somebody else, if you can hold this position for about 30 seconds to a minute, people that sit at computers a lot, you get a lot of neck strain. And the other thing to think about is with our necks, when we're sitting like we should and our head is over our shoulders, our head is about 10, 12 pounds of pressure. When we're just this much far forward, it adds 30 to 40 pounds of pressure on your cervical spine. And if you're familiar with the cervical spine, they're not, they're small vertebrae, and that's a lot of pressure. So whatever we can do to relieve that pressure. So when you're sitting, just being mindful of your posture. If you feel yourself kind of slouching forward and your chest is coming in, just sit back, take your arms around the back of your chair, and just give yourself a nice stretch here. Just open up that chest. If you can do this where you're sitting now, I would invite you to do this. You just reach around and grab the back of your chair. And then you can turn it into a twist by just going like this. So we went from the back of the chair now to the sides of the chair. And you want to hold for 3 or 4 breaths. The body takes a little bit of time, and we want to be patient. And then when you're done with that side, just scooching to the other side and twisting. Taking some deep breaths. And if you're able to stand up from your desk, you can do your hip circles at your desk. And if you're able to do that with me now, so you're just going clockwise. And just really work slowly around, switching directions. So these are ones you can do at your desk. So you've got your around the back of the chair, you've got your twist, your hip circles, and then wrist flexion. So because you're forward a lot, and people, you've probably heard of carpal tunnel, that's an overuse injury. So just taking the wrist, the tip of the fingers, and just holding back like this, a little wrist flexion, can relieve a lot of this tension in the wrist here. And it also gives a little bit of palm stretch as well. And we do everything on both sides of the body. So go to the other side now and give yourself that nice stretch. So there's a few you can do right there at your computer. The next two we're going to talk about remember the energy meridians that I had showed you in a previous slide. So you have 2 meridians in your hand, and so some of you may already be familiar with this one because it has a slang term as the headache point. And so you're going right here in the belly of the muscle here. It also feels really good for hands that are off on computers and around keyboards, steering wheels, or other utensils. It's known as an analgesic point. So it's a natural aspirin and just stimulating. So it's just a little pinch, just like that. It's right there in the belly of the muscle. If you are prone to headaches, this can be a really great pressure point to access. If you get to it before the headache is into its full blown, oftentimes you can ward the headache off, but usually once a headache's on, it's going to go run its course. But this can help minimize the pain. So this is actually large intestine 4. This is part of your large intestine meridian. So this is your headache point. And then large intestine 11. So just take your knuckle, and this measurement is known as 1 sun. And take your elbow, so you're going right to the crook of the elbow, take your 1 sun, and you're going to find your pressure point. And that's large intestine 11. And this is an energy point. And again, it's nothing fast. We just work these points, just stimulate them 30 seconds to a minute. You want to do everything on both sides. So let's get our large intestine 4 on the other side. I did want to just make notice that I saw that question about a sheet on these, and I could certainly do that. I don't have one, but that would not be hard to do. I don't know how I would get it to you. I guess, Dr. Joy, is that something we could do?
Yeah, that's a great idea. And what we can do, Liz, you and I can work together to create a fact sheet, and we can post it on the Intermountain Healthy at Home website, which is where the information on the webinars is. So let's you and I connect offline to do that.
Sounds good. Okay. So this is large intestine 4 and 11, and then auricular points. So you have 63 auricular points. Isn't that amazing? These little earlobes are just loaded with power points. So you probably notice people with little ion, like gold or silver ions in their ears, and they're stimulating these different pressure points. So if you just work around your earlobes, and you'll probably feel a warming sensation because you're stimulating these pressure points. And you can also just give a little tug. That will help your jaw also. Your ears need to pop, just pull back. And close your eyes and, just enjoy this sensation and really be focused on your ears when you're doing this. So there's a few that I thought were some good ones to share. We're getting close to the end, so let's see what else. If you have any questions on those, let us know. But I had trouble seeing, large intestine 11. I can be more specific when we do the paper. So, and just some of the benefits, I think it's really notable. Reduce muscle tension, improve circulation of blood and lymph through the body. It improves our skin and muscle tone, stimulating lymphatic and immune system, especially now with everything we're dealing with. We want to keep our immune systems at their optimum level. So massage is very helpful and friendly to the immune system. Reducing stress hormones. So we're able to relax more. We can sleep better. So when we wake up more, deeply rested. And then we need to sleep, and that's how our body restores overnight. We need that rest time so that the next day when we get up, we're not borrowing from yesterday, that we have this deep rest and we feel like we can move on fresh and with good energy. Increase joint mobility and flexibility. You've probably heard motion is lotion. So massage often is used when people are in rehab because they can't do the exercises that we help them able with their flexibility and range of motion. Helping with your breathing. When you calm your breathing and focus on those deeper breaths will really help, because when we do feel anger and stress, or if we're in pain, we do this wincing, and then we get our jaw really tense. And then when our jaw is tense, then our neck is tense, and everything just goes down the body. So when you feel like you're getting a lot of tension here, realize the ripple effect of what's going on and go to your breath. Use that 4-count breathing or something like that. And just understanding the difference between the sympathetic and the nervous system and the parasympathetic. So this is our rest and restore, and this is where we want to be. And so everything matters. That's why I say, if you're going to do this for someone at home, make sure you dim the lights. If you're going to do that restore pose, the waterfall, dim the lights. Really set the tone for the body and the mind to come together and align in this intention of relaxing and restoring. Yeah, just, a lot of times just the power of touch, just even holding someone's hand sometime if they're really hurting. I've been called into the hospital to work on people, and generally I'll do reflexology because that's about the most accessible area, and it's affects such a wide array parts of the body that it's the easiest and the most healing modality that you can do for somebody if you have limited access. And this is just a fun move. This is a little Thai move. So it's just another spinal twist. So there's different ways that we can help each other and do different things. If you're working on yourself, or if you're going to share some of your new skills with friends, there's some really easy things to learn and be able to do. And 5, 10 minutes, 15 minutes, you can make a lot of difference for somebody. So I went over just a little bit, so that anyway, but that's the presentation. Yeah, reflexology, lots of science-backed information on reflexology. It's thousands of years old, and as Chinese medicine is. So
well, thanks so much. Thanks so much, Liz. That was awesome. And I drank this Kool-Aid a long time ago, and I have just enough knowledge about this to probably be dangerous. But I say that, kind of tongue in cheek, because it's pretty hard to hurt somebody, with this, particularly with the techniques that you shared with us today. They can be, applied to ourselves, as you mentioned. We can share some of these with, friends and family. And so I see lots of messages in the chat thanking you for this, and developing a fact sheet with some of these tips that you shared today. And you and I will work on that, and we will make sure to get that along with some of other fact sheets onto the Intermountain Healthcare Healthy at Home website. Because it can be incredibly beneficial. For those of you who may have joined late, just a quick notice announcement that for everyone who joined the webinar today, we're going to put your names into a drawing for a free massage up at the Park City Live Well Center. So keep your eye out for that. I'm sure you'll get an email probably from Patty Taylor, who will let you guys know who was the lucky recipient of that gift certificate. And just as our time is coming to an end, a reminder to everyone that our next Live Well webinar is on Wednesday, September 15th. And the topic is physical activity and exercise with your kids. So we want everyone to be active, and turns out kids are going to kids are highly influenced by their parents. So if you have active parents, you're likely to have more active kids. And we'll be hearing from Suzanne Walton and from Dr. Karen Springer, who will be presenting in 2 weeks on Wednesday, September 15th. So thanks again, Liz. Really informative. We love having you join us on the Live Well webinars. Thanks everybody for joining us today. Check out our website in the coming weeks, and we'll have that fact sheet up there on some of these massage tips. Have a great evening, everybody.
Perfect. Thanks, everyone.
Bye-bye.
Bye-bye.